off?
Well, it is, as you say, a major challenge. Unquestionably, it's a major challenge. But this is an issue really facing all countries. The United States, which is obviously a bigger country than us, they have also faced this challenge and haven't actually met their targets. We know that they was targeting to have vaccinated 10 million of their population. They only achieved 4 million so far. So yes, this rollout is difficult. It is a challenge. How confident are we? I think if we do it, it will be unprecedented. We've never kind of been faced with having the challenge to immunize the entire population, adults and younger people. Up to now, we've really focused on infants and young children in our immunization programs. Even then, that's been a major challenge to get to targets. So you're absolutely correct. This really will be a major challenge. Hopefully, we'll meet it. There's a lot of preparation has gone into it. I think a lot of it was actually revealed in the minister's press briefing the other night. And we really remains to be seen that we can accomplish it. I hope we can.
Well, and I guess time will tell, right? So let's be optimistic and try to understand the tools that are likely to help us get there. Part of what we learned from that extensive briefing with the minister was the electronic vaccination data system. My understanding is that this is essentially a system that's meant to house the data of every person who's likely to receive a vaccine. Again, 40 million people on one system. Do we have the infrastructure to be able to pull something like that off by the time we need to?
I wish I could answer, that is really in the Department of Health.
Yeah.
It's not really part of what we've as an advisory group have actually dealt with. But, listening to the press briefing, there certainly seemed to be confidence coming from the Department of Health that, yes, they could accomplish it effectively. I think there's been a lot of sophisticated development that has taken place in the Department of Health and generally in the country. So we should have those resources and we should be able to meet that challenge.
All right, let's speak about the advisory committee then. The one you chair is the MAC on vaccines. What I found interesting is that there's an ethicist there, someone who I guess is, au fait with issues around ethics when it comes to vaccinations, et cetera, et cetera. Can you take us through some of the, ethical questions you're battling at this stage of our preparation to roll out this vaccine?
Well, the ethical question is really around the equitable distribution of the vaccine.
Yeah.
So that's, we've got several what we call work streams, which are looking at specific projects. One of them, and one of our kind of major ones, in fact, is looking at how to distribute limited amounts of vaccine. Because what's going to happen is, of course, that the vaccine is going to come in tranches. It's not, and this is throughout the world, it's not going to come all at once. So the first amount of vaccine that will come ethically really needs to go to the healthcare workers for a number of reasons, obvious reasons. They're vulnerable, and also they are the most precious commodity in terms of dealing with our health. So that kind of ethical considerations of how to distribute the vaccines, people that are at risk of getting infected, people that are so critical to maintaining the health system, and also people who are vulnerable to more serious disease. So these are all the ethical considerations and actually in allocating, because obviously everybody wants the vaccine. Everyone wants their own personal protection. And we need to look at those ethical guidelines to see how to distribute vaccine in the most ethical way possible.
Yeah, for better or for worse, we live in a context where your financial income or your financial status could actually determine whether or not you get to live or die. And we're seeing that almost on a global scale where there are much wealthier countries procuring arguably way more than what they need in terms of getting a vaccine. How is that impacting our ability to enter bilateral negotiations, which we know are very crucial at this stage of South Africa's fight against the pandemic?
Yeah, I think that's the important question, because what has happened, as you say, there has been a scramble by the high-income countries for vaccines. In many cases, much more than their population needs, and sometimes 3 to 5 times the population needs. So these manufacturers have committed their vaccine stocks to these countries. And the middle-income countries have banded together to form COVAX, it's a facility which is now well known. as a result of this, because they were left behind because of the scramble for vaccines. So COVAX was established to get equitable distribution of vaccines around the world for that precise reason. So now we are securing funds through the business sector, through the private sector, and now the challenge is to actually negotiate with vaccine manufacturers for their stocks of vaccines. And we're confident that there will be vaccines coming to us over and above what we committed to COVAX. But COVAX was the kind of fallback position, which most of the middle-income countries around the world have kind of subscribed to, over 190 countries around the world.
Yeah, and of course, COVAX is just one of a few others. And, you know, I understand the argument that government is making. We couldn't necessarily commit to other vaccines in case they don't necessarily, you know, turn out to, in fact, be appropriate for our population. What is interesting, though, are questions around why South Africa can't, in some respects, then go on to produce our own vaccine once we have an idea of what the vaccine actually works like and looks like. Take us through why something like that isn't possible, especially for people who aren't, of course, in the industry and don't necessarily have, an intimate understanding of how things like patents work. Why can't South Africa, for instance, get a single vial, examine the vial, and just reproduce whatever we find here in home soil?
I wish it were as simple as that. Fortunately, it's not. It's a high-tech industry, and the actual process of producing the vaccines are complicated. Vaccines have to be both highly effective and have to be highly safe. They have to be very, very safe. We're giving to healthy people. So to kind of satisfy all those criteria, to go through all the rigorous examination of safety and efficacy, you need a very high-tech product. We do have some manufacturing capacity, but unfortunately, not at this stage the ability to actually produce the vaccines. That would have been ideal. Clearly, all we do have at the moment is the ability to fill, and this is what has been done. For example, with Aspen, the company, they've contracted to get bulk vaccine and fill and distribute into vials and to pre-fill syringes. And hopefully there will be some spin-off of that. Also, we were hoping that there would be some spin-off from the clinical trials, because the clinical trials were conducted in the country. But unfortunately, that didn't materialize.
So just before we had to take that quick breather, we were just about to delve into, questions around what, if anything, South Africa has to show for entering, clinical trials as part of a global effort to try and push back against the pandemic. One of those trials had to do with the Oxford vaccine. The exact technical term escapes me now. What do we have? What do we have to show for that now, as we scramble to get this treatment ASAP?
Well, there was certainly advantages in doing the clinical trials in South Africa because we trialed it under South African conditions. So that was very important information. It also gave us the skills to monitor how these vaccines were behaving, and that would be very good very useful, very valuable once these vaccines were introduced. But I think you're right. I think you touched on an important point. It's a pity that when there was a great excitement when it was announced that the trials were taking place in South Africa, the AstraZeneca in Johannesburg, the Johnson & Johnson in Cape Town, and those principal investigators, I think at that stage, I think they were asked, will there be some spin-off to South Africa? And they said, well, it's not really up to us. And it's a pity that was an opportunity lost, because they might well have, in fact, secured as part of the condition of the trial, because obviously they paid for the trials. They as part of the conditions to, in fact, see that South Africa would get allocation or a dedication to supply South Africa with at least some vaccines, because they were using these overseas manufacturers were using South African resources, South African skills, South African population. And I think it would have been the kind of honorable thing to do, to require it as part of doing the trials, that there would have been an allocation to South Africa. That opportunity was missed. We might have had vaccines.
Such a pity. There's also been questions around approving vaccines for use in South Africa. I know SAHPRA, the South African Health Products Regulatory Authority, in some respects spearheads that. Why isn't it possible for an institution like this to see a vaccine being administered in Russia, for instance, the Sputnik 5, or a vaccine in China, and gauge how that population is responding and use that as a basis to try and see if we're able to actually deal with, that treatment. And again, in the back of many South Africans' minds is there are vaccines being used elsewhere. What makes us believe they won't work here?
Yeah. Look, our South African Health Product Regulatory Authority is a very reputable and a very reliable, very authentic body. They need to see the data. And yes, there's an open mind, a completely open mind to both the Russian vaccine. We've had talks with as our committee, we've met with the Russian manufacturer and also the Chinese manufacturer. Both vaccines on paper look very good, and they probably are good, and they're probably very good. But we do need the data to support it, because the regulatory authority has to be satisfied with both the efficacy and the safety. And they can only do that once they have verifiable information to kind of establish that. Unfortunately, as yet, we don't have that. But obviously, we are very welcoming to receive that data. Also, it's not we, but SAPRA, very welcome to get that data to have a look at those two vaccines.
Yeah, but is it just those countries withholding the data? Help us understand why there's a delay in the transmission of something as transmissible as data.
I don't think that they're deliberately withholding. I think that their trials haven't advanced to the stage as yet that they've got the data to publish.
I see. All right.
There are something like 289 candidate vaccines being investigated from a laboratory stage, the clinical stage, through the to the final licensing stage. And even the clinical stage, there are only, I think, about 60-odd vaccines which are on the clinical trial stage. And those clinical trials have to run their course to get reliable, verifiable data on which to examine these vaccines.
Well, thank you very much. We certainly appreciate your coming on and helping us understand the machinations behind the scenes. I think that's important for, at the very least, public buy-in, which is going to be crucial for the success of what we both agree is an incredibly ambitious vaccination program. Appreciate your time here on the AM Report. Thank you very much indeed. Professor Barry Schoub, who is the chair of the MAC, that's the Ministerial Advisory Committee on COVID-19 vaccines. Right, let's give you a sense of news-making international headlines now. UK Prime Minister Boris Johnson has announced a new nationwide lockdown for England. Under the new restrictions, people across the whole country have been instructed to simply stay at home under a few exceptions. All primary schools, secondary schools and colleges will move to online learning, and the sale of takeaway alcohol will no longer be allowed.
Hospitals are under more pressure from COVID than at any time since the start of the pandemic. In England alone, the number of COVID patients in hospitals has increased by nearly a third in the last week to almost 27,000. And that number